hospital rooms, right? But they do have some of these Whirlpool tubs that you can seek out, you see. I like both. You know, as I get older and my knees, you know, I keep on looking at in the Costco, you know, they send the circular because I'm a Costco member. I keep thinking maybe I want to get one of those walk-in bathtubs. You know, because my knees, you know, you get in a bathtub, you know how the bathtubs are, you know, you got to get up. And
those look cool.
I've got to get some of this weight off of it. Bath, shower. Do you prefer to have your shower or bath in the morning or in the evening? See, some do, okay, some do both, right? Some prefer to have their shower as soon as they wake up, right? I'm a person that takes mine in the evening. That's what I do. That's my habit. Elderly won't necessarily bathe every day because, you know, they lose some of their skin oil, so it tends to dry their skin out. And sometimes some of our old grandmother, great-grandmother, you know, our grandfathers, right? Well, I took a bath last Sunday, you know. Well, right? I mean, you know, you've heard that. My husband's dad he says, well, boy, I just took a bath last week. You know, that's Southwest Virginia talk. Yes.
When I was in high school, one of the teachers told us a story about everybody, the oldest would go first to bathe, and if you were the last one, you were in trouble. Just bathe in the same water.
Yes, yes. How many's had that? How many's done that? How many, honest to God, did that as kids?
He's the only child.
Oh, am I the only one that's going to raise the hand here? Yes.
We all took a bath at the same time.
At the same time, that's what we did at
No,
the
we
same
didn't do
time.
that. Because I was the only girl.
We did the all same time.
And I had two older brothers.
Oh yeah, you have to take it by
So
yourself.
it was three. No, I think this thing went on till I was at least like 10 or so. We did the same bath water. Oh yeah, oh yeah. I don't know. I only want to raise my hand, but
We got 7 chapters from.
that's all right. That's the way it was. That's how it was, you know. I grew up that way. I didn't know any different, right? Cultural, religious, or spirituality issues. We have to honor our patients. I'm not making you nervous back there, right? And let's see now. Let me think. Help me out here.
What's your name?
David, okay. I get nervous with that camera, so Brian and David are okay. Okay. But anyway, guys, consider their religious or their cultural beliefs. There are some situations, like for instance, like the female, that's the time when they're doing their menses. It's sort of called an unclean time, or they have to have ritual cleanings. I mean, these things are real scenarios that take place in the hospital. So you have to abide by them. Now there's a limit of things, right? Those cultures where the body odor will just knock you down. I'm sorry, that's a bacteria issue, right? Well, I mean, you know, we've got to, you know.
Yep.
Right.
Right.
Honest to goodness, economic status, the lack of money to purchase. Do you get that can of tuna fish, or do you get that bar of soap? Well, I mean, people are that poor, right? We're in really bad economic times, and things are costly. I mean, it just about knocks your socks off pulling into one of these gas stations, right? The gas is just ridiculous. It's going higher and higher, and so that impacts groceries, because the trucks deliver them to the stores. You see how it all, it's just a vicious cycle here. So we have to we have to understand why in some situations, there might be individuals that aren't as hygienic as we would like them, but we must not show preference or, or a bias. We must, understand what's happening to them. And you can't understand what happens unless you communicate. Other things, lifespan changes. As an infant, we have everything taken care of for ourselves. Adolescents, they are especially zeroing in on their body because image, that's what matters, right? Same thing goes for the young adult. The older adult, maybe they start getting too frail or too sick to literally be able to get into their bath at home. They're alone, they're depressed. They're alone, nobody's there, so what does it matter? Or I don't feel well enough to do this. Or I'm afraid I might fall. See, these are things that can happen. I can't emphasize enough about oral hygiene. I've had patients in the ICU be admitted, they're in septic shock, and they call in a consult infection control doctor or infection disease doctor. I'd say, well, I'll tell you exactly what's wrong with this patient. This patient needs a dental consult. He's got a mouthful of abscessed teeth. It's not quite as bad as when I started off, the oral care that I used to see in nursing homes. Because they have really stepped up the training and importance of hygiene in the nursing homes. I will say that we can get admissions into the hospital of individuals that have poor dentation. Because I tell you what will happen is the CNAs will tell that DON, this person needs to be seen by a dentist. See what I mean? They've been trained, they're getting more and more training. Well, it depends on the nursing home, truthfully, but the ones that I've been going to, highly trained staff there, and they just, they're not going to let go. If they have to get a dental consult to take care of an issue, they're going to. But in the hospital, it's just interesting state of affairs. Person comes in and they definitely have such a poor dentation, and we don't do anything about it. So my dad's been dead for 12 years. He was a dentist. And so I always dedicate, if ever I get the opportunity to teach hygiene, or I always plug the importance of oral hygiene. The importance for you guys too. You guys don't realize when you eat food, it's just like decayed stuff that gets trapped in the areas, right? Y'all need to make a point of flossing your teeth. I used to, and I didn't do it for y'all's today, but when I would teach this section, I would pass out dental floss. And while I'm lecturing, I would make y'all be flossing your teeth. Because it gives a new perspective of just how we overlook things. So if we overlook our own care, it's so much easier to overlook a patient's care. Do you see what I'm saying? What a topic to talk about, isn't it? Oh, y'all love it. But see, somebody has to just really talk about, and how to make sure y'all clean the back of the ears, because it's really bacteria growth right back here where my glasses sit. How much that's overlooked, right? Again, a person that is not well does not have that ability to do the routine hygiene that maybe they want to do. They have pain, they have limited mobility. You see, it makes sense, doesn't it? So I look for healthcare to really change here in the next few years. I mean, we're already seeing it change where it used to be all the emphasis is everyone in the hospital, but now the emphasis is not less people in the hospital, more people out in their homes, and we're doing proactive and promotive types of nursing care. We can go into their homes and we can teach. If I have a group of you in my health promotions second quarter, right? That might be something that I'm going to have y'all do, is just go over a teaching pamphlet with them about covering hygiene aspects, because I think that's important, because if you have good hygiene, you're going to feel good and you're going to have physiological better health. Sensory deficits. Sensory deficits, and here's a situation: you have a patient that's on anticoagulants, and you guys have already learned about those, haven't you? Mm-hmm. Have you? Yes. You know, yes. That Coumadin, they're on Coumadin and whatever. But it slows that clotting time down. We would want to make sure that that individual would use an electric razor, for instance. Right? It makes sense, doesn't it? Don't give them a straight razor. Visual limitations. Because even the blind have to have hygiene, don't they? You might have to give them some direction, guidance, or hearing loss, for instance. They would have to have what? Written instructions. It also depends on their cognitive level. For instance, you have individuals that have mental health issues, disorders. They are not themselves. You all have seen them, right? Y'all have seen them on the streets, right? That's why they're on the streets. The mental health is the hospitals, the state hospitals. They no longer have. They've gotten downsized. It's like maybe the max is 300 bed capacity out of the state hospital on South Crescent. So it used to be what, 3,500 patients years ago, you know.
So you talking about bipolars on the street?
Yeah, or schizophrenics on the street. You know, they're all, you know, it's sad. But see, they have an illness such that, you know, they not even awares, you see. But you guys all have seen it. You know you have. Every day, every day. Depression. Depression's a funny thing. We all can have depression. Y'all can have depression. Y'all can have depression. You say, I just, you know, I'm bombing out at school. I'm not making it. You see what I mean? And then sometimes when you're that depressed, you don't have the energy to do the things that you normally do. Hygiene starts faltering, right? Let's think about the patient that's critically ill, that's in the ICU. Come on in. Or you don't want to? No?
I'll have a seat up front.
Okay. Anyway, the patient in the ICU, those individuals are so sick, they don't know if they're going to live from 1 minute to the next. They're connected to all these tubes and these ventilator and the balloon pump, and they're on pharmacological agents that maintain their blood pressure. They're in a state here. They have an art line, they have Swan Gans, they got a Foley catheter, they got an NG tube, they've got an abdominal wound and it's open because they have developed MRSA in their wound from surgery, poor technique, or whatever. Those individuals have to rely on our care. And we cannot just go in and swoop and do it all. That person, you do too much, and you can cause them to arrest. It happens. It happens. I've frequently seen a patient after they've had a bath, they have their celestial discharge. They die.
Ooh.
What happened? They used to, night shift. Night shift. Maybe they were, well, we would hope we didn't cause, we didn't rush it. We didn't, but we have to do hygiene, but the fact that they're just so unstable. And you guys will see that too with hospice care. Now guys, that's not to say that you guys will avoid doing cares because they are on their deathbed, their dying deathbed. You still have to maintain the hygiene, because that's just providing the dignity for your patients, right? You have to space things out. Here's an example of schedules of hygiene. I don't know what happened to that evening back rub. It went to the wayside. It sure did.
And it makes you feel so.
Oh, it does. I don't know what's happened to us where we've gotten so involved in technology that we've forgotten what it's really about. You know, this is the art. I think hygiene is an art for nursing. To be able to give the most excellent hygiene. That, you know, people think that it's all these newfangled technology instruments and this whiz pill, and that's what makes a person well, but to be honest, I think when this is neglected, when hygiene is neglected, that's when you can see a demise of a patient, to be honest. I think it has a big part. I'd like to do a research study someday, but I don't have time. One of you guys is going to go on for your master's. Here's your thesis topic about how hygiene can affect and provide a very strong positive outcome for patients. Y'all think about that.
So when I'm feeling depressed, I like to go get my hair and my nails done.
Yes.
It's the whole 9 yards.
And don't you think those ladies that were socialites and now are in the nursing home, don't you think that they would like that?
Yes.
So they actually do have a lot of places, a lot of these nursing homes actually have a beauty parlor, little shops inside their own nursing home facilities. What's wrong with us shampooing their hair and fixing it up? Because I want now, where's my group? Now, hygiene's big on my list. I've already got y'all paired up and some tripled up. Besides doing the head-to-toe assessments, that hygiene and fixing that bed and helping straighten up their room, that's what it's all about to me. Everyone's going to learn how to do that. Wherever you work, you're going to learn the facility's paperwork, right? You've got my paperwork, and you understand what I'm wanting. See, that's not, the most important thing is the time that you spend with your residents. That's what I'm looking for. I don't care how smart you are, you know. You can elaborate on all this lab and what this disease process is, but if you don't know how to take care of a patient, put them on a bedpan or get them up to a shower, how can you be a nurse? If you can't do that, that's what I'm looking. I want to make sure y'all can do that before we move on, because there's no point moving on. You can't move on to these other things if you can't take care of this. This is the foundation. And a big foundation is a necessary thing that we all need, and we all need hygiene.
Yeah.
See? Makes sense, right? Mm-hmm. Yes.
I had experience when I was in LVN school.
Yes, share.
And my experience was big part, want to make people feel good. The best way to make her feel good is to do bad. So I ran into this lady who had MS, and she was fairly young, and she was just, as soon as I walked in the door, she was just, oh, your new face. She said, thank God. She said, I want a bath so bad. She said, you look like a nice person. One story led to another. I said, well, ma'am, I don't mind bathing, and so I proceeded to get everything, went and took in the shower. and I'm doing my thing, bathing her, scrubbing her, giving her the best bath I know how to give. And then this lady come in and she yells at both of us and what are you doing? And you know it's not your time to take
It's
a
not
bath
your
today.
day.
But what it was, she pulled me to the
Isn't that
side and
crazy?
she said that this lady does this routinely. That's how she gets off. That's how she gets an orgasm.
Oh, to have a bath by the staff?
Yes.
Well, okay, that was a little skewed.
That was my first experience.
Let's rewind that video, right?
She said, let's rewind.
That's bad. I thought this story was going somewhere close.
She said, I thought much that though.
Oh, well, but that's a good icebreaker. I won't tell it again. No, but what she did say, what she did say is so true about, well, it's not that patient's day to get a bath. They do have these scheduled days, but I tell you this, in the nursing homes, they have, okay, the A beds get them on Monday, Wednesday, and Friday, and the B beds get them on Tuesday, Thursday, and Saturday. And the Sunday's left to, if they would want an extra bath, or they do some different things. I don't know. But it is true that they have it set up that way, the rotation set up that way. But I say this to you, I say if my patient asks me, even if it's not their day, you guys, my fellow clinical group,
It's a little thing.
all I ask is you follow up with the CNA and say, you know, she's requested, it's okay if we still also give her a bath or shower. It'll be a shower, you'll take them in the shower room. And of course we take care of it. Because if it was your mom or your dad wouldn't, there's no brainer there, is it? Of course, if whatever they want, that's a simple thing. That back rub, though, I tell you, I don't know where that's gone to. And I want y'all to remember that that's something that's really soothing and relaxing. The evening back rub. I had that when I was in LVN school. I started off as LVN too, see. That was in our textbook. In my RN textbook. Huh?
Are we ever taught how to do it?
To do a massage? No, I think it's just going to come natural to you. So yeah, I might want y'all to practice that even if it's in the morning time, not the evening, because we won't have clinical in the evening. Nah, because I just don't. I want y'all to feel that because this is your foundation.
And you just ask them, can I give you a massage?
Yeah, or ask them, would you like a back rub? Would you like a back rub? You'd be surprised. They might, yeah, I think, you know, they'll be in shock. They might say no because they've never had it done. It's been, you know, it's sort of been so far removed. One thing you guys need to remember as being the RN, you have to be careful who you delegate what to do in terms of your nursing personnel, your assistant personnel, your CNAs, right? Because you will be the ultimate one responsible for what may happen. Understand what you can delegate. Understand it. Because you have to select the correct person that they could safely provide the care. And here's a little critical thinking activity question. Assuming all the patients described below are not having any complications other than what is stated, which patient would you as the RN delegate morning care to the nursing assistant personnel? Now out of those, which one would you think to do? And why is that? Why do you choose a 60-year-old? Tell me, Ryan.
Because they're most likely stable, and you've already had 48 hours to monitor them after the surgery.
Yes. And guys, I will tell you, he's right. He's right. I will tell you that this kind of question would be over and over and over on your in-class. You've got to be able to figure out what you can delegate, because we have so much on our plate now as RNs. We have to learn how to prioritize and delegate, but we've got to do the delegation correctly. It's very important. We're going to move on to the discussion of skin. I thought you might like to see an anatomical cross-section. Not that you didn't have plenty of that in your A&P, right? So 5 functions of skin. Number 1, it's an organ. It is an organ, and it's a protective barrier. Intact skin's the first line of defense against bacteria. Again, I go back to the person that has community-acquired MRSA. When they have an outbreak of this, it starts popping up these sores all over their body, and they can get septic really fast if they're not taken care of. Just keep that in mind. We start to see more and more of this community-acquired MRSA out in across the nation. Sensation. Person doesn't have or has decreased sensation to hot and cold. You can imagine you could burn an elderly patient's skin quite easily. I recall when I was in the hospital many years back, and it was my fault, and I told the doctor, because I was one that liked my own heating pad. I told my husband, bring my heating pad from home. I had some surgical procedure. Might have been, I think it was right after I'd had my son. I had appendicitis, and they had to cut me this way because they didn't know if I had an infarcted valve, so they had to get him out 6 weeks before delivery. But I wanted my heating pad, and of course what I did is I would go to sleep with my heating pad. Of course I have it on high. Everything's got to be hot with me, So then the next day, nurse comes in, they about freak out because they see like where that incision was. I have these blisters. So I hate that I think that nurse might have got chewed out by the doctor. But I told him anyway. I said, Dr. Kelly, it's my fault. I'm the one that did this, not those nurses. So I don't think he did, but you got to be careful. See, I was, 28, or I don't remember what age I was. But I did it. I caused it. But see, someone else could do that too. So you got to monitor your patients closely. Yes?
I have a question. Like in the civilian world, in civilian hospitals, do all patients have to have all equipment bought from home? Inspected and approved by the provider before they can use it in the hospital?
Oh yeah, I just slipped mine in.
Oh.
and they would too. Unbeknownst to them, Again, we have so many things going on. You're assigned 12 patients. Who's to say what family member brings in what, right? I knew better, but what was I? I was a nurse. I said, I know what I want, and I want this. Bring me this. But see, if I do that, don't you think family members, other patients that have no health background, they do it too, right? The fact that the skin regulates our heat and cold sensors. When we're hot, we sweat, don't we? Right? Perspire. We have sebaceous glands that keeps our skin supple. But as we get older, everything starts winding down like a clock. And then we can't say enough about the importance of vitamin D, right? Vitamin D, sunlight. That's why you guys in my group, if you have residents, you want to open up the light. You want them to have natural light in their rooms. Don't leave it dark. Don't leave the shades drawn. That's depressing. We're adding to their depression. Would you like to go outside? Let's go outside. I'm going to take you. Come on, Don, who's your partner? You got 2. Yes, you do. There's a threesome. You and, where, yes,